It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives. Changing lives. Changing lives for the better. For the better. Changing lives.
Hi again, everyone. Jim Knox along with Candace Kruger, and welcome back to another edition of the Best Docs Network, featuring some of the best physicians in the entire Middle Tennessee area that have helped change people's lives.
Like our first doctor endodontist, Dr. Graham Locke.
I was experiencing some difficulty with some pain in my tooth. It was just a feeling, but it wasn't really painful, but it was just, I knew it was there.
When you look at the x-rays in Jean's case, it looks pretty standard. Silver filling, not a lot of gross decay or anything along those lines. Constantly we have to monitor and test and diagnose exactly what's going on, because symptoms are coming from somewhere. And x-rays are two-dimensional, and only one of the tests of many different tests that we use to determine whether a tooth is infected and needing a root canal.
I'd never had a root canal before, and I was, a little nervous about it. So he explained to me about IV sedation, and I decided that that was probably a really viable option for me.
Some people just require the local anesthetic. Some require the gas, some want oral sedation, and some want IV sedation. We tailor the sedation, whatever it might be, to that person's needs. One of the benefits in this office, was she never felt the injections in her mouth. She never felt claustrophobic under the rubber dam, and it allows us to do that more thoroughly, as well as protect the airway.
When I was given the IV, I did feel the initial prick, and that was the only thing that I felt from then on.
Working under the microscope, once we removed the silver filling, we found a crack. And there was a slight vertical crack in her tooth that did not show up on the x-ray. So using the microscope, you can see down the root canal system many times to the tip of the root internally. It's almost as if you're inside the tooth walking around. And without that, you don't have that benefit. It's a guess.
The procedure was completed, and afterwards I was awake. I was aware of what was going on around me. I was wheeled in the wheelchair into a privacy elevator towards the back of the office and taken downstairs. And my husband was in the car waiting for me, and I was helped into the car, and we went home.
Dana was in a great deal of pain until she met Dr. Kroll. To find out more about Dana's story and other life-changing stories, log on to bestdocsnetwork.com. That's bestdocsnetwork.com.
My pain is basically from degenerative disc disease. I have about 5 discs that are involved in that, and then I have 2 bulging discs and 1 protruding disc. But at the same time, I had a busted hip and 2 bad knees from playing college football.
So trigger points actually often develop in patients who have chronic musculoskeletal syndrome disorders. It's also very common in patients who have repetitive work injuries or hobbies that require repetitive muscle contraction. Sometimes with acute trauma, you can also get irritation and stress on those muscles as well, so trigger points can develop in those situations.
When I met Dr. Rome, I mentioned the pain, and I told her it felt like a trigger point. But all the other people that I talked to in the last year or so said that you don't have trigger points at that level. And she felt and said, you do have a trigger point here. And I said, thank God, that somebody finally has taken the time to listen to me. And I asked her, would she treat it? And she said, absolutely. And she went and got a syringe and injected it with painkiller. And I imagine at least 60% or more of my back pain that I had had for 5 years went away that day.
Well, one of the first things that I noticed about Ed is that he had some significant myofascial pain symptoms in his back. He had several trigger points that I noted in his lumbar paraspinal area, and we were going to go ahead and treat that with trigger point injections. Ed so far has received significant benefit from his first and second trigger point injections. We plan on following that up with a series of 2 or 3 more, and hopefully that will eliminate the myofascial problem. He also has some symptoms from his degenerative disc disease, and he's going to be following up in the CPS clinic for lumbar epidural steroid injections as well to help those symptoms.
I'm carrying out the trash, I'm mowing the grass. I don't have to carry this cane anymore to walk, and just thank the world of her for listening to me. My life has been changed since that day.
And I am with Musicians on Call, and our mission is to bring live and recorded music to the bedsides of patients in healthcare facilities. We're here tonight taking Ashley Gearing room to room to play music for patients.
I'm volunteering tonight here with Musicians on Call. I sometimes may feel a little goofy walking into a room with a guitar by myself, but then you see the reaction and you see their expression completely changes.
Well, I had some rather serious medical conditions. I was diabetic. I had to have a hip replacement, and the doctor had told me that there was nothing left he could do for my back, that the arthritis had fused the vertebrae together, so I desperately needed to lose weight.
Well, I was very supportive of Bill because he had so many medical issues. I also had a lot of medical issues, but not nearly as severe as he did.
And one of my coworkers had been here and had a lap band procedure, and she'd lost 80 pounds in a rather short period of time. So I said, what in the world have you done? And she said, I went to Centennial Medical.
One of the strengths of our program is that we do all of the procedures. We try to allow the patient to make the decision for what procedure they think best suits their needs. Certainly help guiding them in that decision, but allowing them to make that decision once they've been appraised of all of the intricacies of the different operations that are available.
I started coming to support group with Bill, and we would come at least twice a month. After about 3 months, going from saying I would never have weight loss surgery, I was all for it.
Some of the results that we see with appropriate weight loss is people being totally off all of their medications, clearly off diabetes medicines.
Within 6 months of my surgery and losing weight, I was only on 1 prescription. No more diabetic medicine, no more high blood pressure medicine. So it's like a whole new world for us.
We're best friends. We're hardly ever apart. We like to be together and we like to do things together, and with our health, it was becoming more and more difficult to do anything.
I feel 20 years younger because I felt like I was 10 years older than what I am. Couldn't hardly walk. We never walked anywhere. We just didn't. We weren't active at all. We'd sit on the couch. And now we go to the zoo. We love to walk. We go to the rec center and work out, and we're having a great time.
My diabetes is almost totally uncontrolled by diet alone. I had almost a perfect blood test the last time I saw the doctor. I feel like going to work. I feel like a new man.
I was 21 years old when I was diagnosed with stage 4 breast cancer. And when you confront your own mortality, you realize, what am I going to leave behind? I'm never gonna have children. I might not see my husband grow old. What have I done? I'm sitting here today with tumors in my liver, my lungs, and my bones. But I'm sitting here with hope. My name is Bridget Spence. I am Susan G. Komen for the Cure. Help cure breast cancer and save women's lives.
A lot of my patients worry about dementia. They think they're getting Alzheimer's disease. The main thing that worries people is they go into a room thinking they're there for something and can't remember what they're there for. That really isn't dementia. That's just being overwhelmed with life, having too much on your mind, and just generally the human condition. Dementia and Alzheimer's disease is characterized by people who sort of forget where they're going, for example. They have to call home and find out how to get home. They've gotten lost driving. Or they forget names of people, or they forget places that they're supposed to be. Pretty obvious things. Also, dementia is a progressive thing. We don't see dementia happen just a little bit here and then a little bit there and stay the same month to month and year to year. It tends to be worse and worse and worse. For example, you and your family and your friends will notice that you're worse now than you were 6 years ago or 6 months ago even. So it's important to not worry about the small changes. It's those progressive changes where you lose your memory for things that you should remember.
I came to see Dr. Gilmer because I was referred to him by somebody who used to shop with me at a clothing store that I worked at. So she'd just gotten her procedure done with Dr. Gilmer, and I'd always thought about it, so I came in to see him.
Brianna came in requesting a tube augmentation, and what the tube augmentation is you put the implant in through or around incisions around the umbilicus, the belly button. Now, that doesn't leave any scars on the chest. It's a quicker operation, has less complications, and it's less pain.
I came in and met with Dr. Gilmer, and everything was just set up very quickly after that. I think I was on the books in less than a week. You know, I'd already made the decision to have the procedure, and Dr. Gilmer just made it very easy.
And when we talked to Brianna, we asked her exactly what she wanted and how she wanted it done. Did she want the implants put above the muscle, or did she want the implants put below the muscle? What size she would like to be, and all those things were discussed with the patients at length. Now, when you go through the belly button, you can only use saline implants. So if a patient elects to go with silicone implants, they have to have a different surgical approach to put those implants in.
You know, I was more nervous about being put to sleep than anything. I'd never had anesthesia before, and they made me feel very safe and secure in that decision. Everybody was very professional and courteous. I didn't feel uncomfortable at all. Sometimes you think there's a stigma attached to it, to having the procedure done, and I didn't feel that way at all. I wasn't hesitant in any way.
The procedure takes from start to finish, anesthesia, awake, about an hour. She's in the recovery room about an hour, and then she goes home with assistance.
I'm very pleased with the results of the procedure performed by Dr. Gilmer. It was something that I had always wanted to do, and it's made a big difference for me on a personal level. I feel a lot more confident in myself, and it was something I decided to do for me, and I'm very glad that I did.
As always, for more information on any of the amazing doctors you've seen on today's show, just log on to our website, bestdocsnetwork.com.
Best Docs Network, of course, is the #1 medical video source as far as educating the public. Right now, time for our next Best Doctor. It's Dr. Peter Kroll.
When I was younger, I was in a really bad car accident, and I broke my back. I had fusions put in my back and rods, and 2.5 years after that, they removed them. After 5 years, the fusion broke off, so I had to go under another surgery. The third surgery is when they removed part of the disc, and they cleaned out scar tissue of the nerve ends. Now I've got bulging discs, and it's constant pain. Surgery will only take part of the pain away, and I really don't want to go through surgery again because it can paralyze me.
Unfortunately, patients who undergo surgical spine procedures often after surgery still suffer from pain in their back or what we call radicular pain into their arms or their legs. These patients, through treatment and evaluations of their surgeons, often find that there are no additional surgical answers for their conditions.
And I came to see Dr. Kroll, and he started talking about the stimulator. He wants to wait until it's absolutely necessary. So we're trying to deal with my pain through medication only.
Tamara now has been seeing our office, I think, for about 2 years now, and we've treated her mostly with medication regimens. Over time, sometimes medications their effectiveness may become less effective, and patients' medication regimens need to be changed. And we've done that occasionally with her, and are currently working with her to increase the effectiveness that we can with medications.
Since I've been here, I've been walking more. I've been getting out of the house more. Before I wasn't able to travel. And now recently I was able to go and see my sister in Virginia, and we went on a tour with Segways through Washington, D.C. I'm able to do more things with my kids and my husband. Dr. Kroll is awesome.
A typical candidate for LASIK surgery is somebody that wants to reduce their dependence on glasses or contact lenses.
I went to see Dr. Bregman to free myself, to actually not have to deal with glasses or contacts, which I have both.
It's very important that everything gets triple and quadruple checked. Their refraction and everything else in the chart, that we're doing exactly what's supposed to be done to treat their eye.
Well, I was referred to Dr. Bregman from Dr. Beam, and so my first meeting with him was a consult. You went in and he kind of tested your vision, and then briefly spoke about the procedure and about LASIK surgery, displayed the options that I had.
A lot of people ask what happens the next day, and I tell them that the vast majority are 20, 40 or better the next day, and usually go about their business. And most of them can even drive the next day. It's very important to make sure that they're counseled correctly. The biggest mistake any doctor can make is tell them, I have a 100% success rate, you can go throw your glasses out after you have this done. I always tell patients it's a procedure to reduce your dependence on glasses or contact lenses. That not everyone can completely get rid of them, but that the majority of people do.
Basically, again, no pain. I say probably within about 2 or 3 days. I had no longer any kind of blurriness or that fishbowl effect that he was talking about. I had to wait a week to ride my motorcycle, and then come the following Friday, I was on there and I was riding around and just enjoying everything. Just taking it all in. It's been wonderful.
There's never a day that goes by where I don't have a fulfilling day at work. I don't know a whole lot of people who have jobs like that. Doing eye surgery to me is just, even though it's a lot of the same procedures, it never stops being interesting. There's always something more to learn, and you're dealing with someone's sense organ, and it's very important to people. And I feel like I'm really making a difference in people's lives.
Life has just totally changed, and I love Dr. Bregman for doing that for me.
Well, the ideal candidate for bariatric surgery is a patient that has many times struggled with obesity, maybe for their entire life. They have gradually gained weight to where they get to be about 100 pounds over their ideal weight, body mass index 40 plus, and start to develop medical conditions directly related to their morbid obesity, things like diabetes, high blood pressure, joint problems, sleep apnea.
When I got out of the music business, I started putting on a little bit of weight. There wasn't as much emphasis on how I looked, I guess. And then I had a baby, gained 70 pounds, and I really never got that off. I had trouble getting that off. And through the years, I just inched up a little bit each year, just put a little on every year. And one day I looked up and I was seriously overweight.
Joy is somebody that I have known for probably 25 years. And Joy talked about doing bariatric surgery for some time, and we talked one time and she never did follow through. But it was really when sleeve gastrectomy started coming into mainstream, and we were offering that here at Centennial, that Joy really got interested in bariatric surgery again. And so I talked with Joy and her husband, JR. We talked about the different operations, and she just felt sleeve gastrectomy was the perfect operation for her.
It took about a year for me to work up my nerve to book my surgery, and decided that the sleeve would be the best surgery for me.
I'm very happy with Joy's results. I think she has reached the goals that we set out for her in the beginning. Her medical conditions
are almost totally gone. She's off most of her medications, and so she's had excellent results.
Once you get past that point and you throw out all your clothes that are too big for you now, and the reality settles in on you that you're not an overweight, obese person anymore, then this whole other world opens up to you that you had almost forgotten. And that is the most thrilling thing.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
When I was diagnosed with breast cancer, both of my daughters were pregnant, and everything I was looking forward to turned into everything I was going to miss. First words, first steps, being there for my grandchildren, for my daughters. Today, those babies are 3. I'm with them all the time. I don't know what's next, but I know I'm here today. My name is Olanthea Pena. I am Susan G. Komen for The Cure.
Help cure breast cancer and save women's lives.
I had some pain for some time on my right knee. So I says, well, I can't handle it anymore. I better go check it out. So I go see Dr. Renfro. And he said, well, looks like you should have a knee done. I said, well, not yet, Doc, if I really want it done yet.
When Mark first presented to the clinic, I'm not sure he was convinced he had arthritis to the degree that he did. So we did the usual things. We started with anti-inflammatory medication. I think he also had a couple hip injections. Once arthritis gets fairly advanced, those things help just temporarily and didn't really give him any lasting relief. And then we started talking about joint replacements.
It was one of those things you hate to do it, but then you have to do it. You get where you want to say, well, gosh, do I really need it? Can I live without it? And you say, no, I better get it done.
So we did his knee replacement first, and knee replacements take a good bit more therapy. And he did fine with that. He actually did very well with it. And then after his knee quit hurting, he started realizing his hip did hurt a lot.
Knowing Dr. Renfro I was pleased with the work he did on my knee. I was satisfied, and I said, well, I'll check him out again. I'll go see Dr. Renfro again for the hip. He did x-rays on it. He says, yes, looks like the bone is bone, they're working at it. We better do something. We set up an appointment, and I did x-rays. He looked at it, and I was in the hospital, I guess, again, at the center here for about 2-3 days. And then I went to rehab again for about, I guess, 3-4 weeks.
I've had some patients go back to work in 2 to 3 weeks, and again, it depends on what type of work you do. Usually by 3 months, we've dismissed a person, and they're still having some mild symptoms. But by 6 months, most people are completely over it, and they don't even realize they've had surgery done. Hip replacements more or less just need to get up and walk and do some simple exercises. And again, he did great with that. He's really able now to do more. He's an active guy. He's able to do things he wants to do. There's no limitations from his right hip and knee, and he's been very pleased with the result.
So far today, everything's fine, working beautiful. I'm running around dancing and doing the whole bit.
I've known Dr. Gilmer his entire professional career. I started noticing the Christmas pictures, and I had these horrible bags under my eyes that make you just look stupid. I'd always thought to do something about it, and then we just kind of got to talking one day, and he said, we'll just pick a time, I think it was in January, and we'll do those eyes for you.
His complaint was that he had droopy eyelids, he had bags underneath his eyes, and he was always being referred to as looking tired. And he wanted to know what we could do to help alleviate that and to make it better. So we discussed a blepharoplasty with him, and he felt like that was an ideal surgery for him. A blepharoplasty is one of the most common procedures that we do today. It really enhances somebody's youthful appearance. And what blepharoplasty consists of is removing excess skin of the upper eyelids and fat pads, excess skin of the lower eyelids and the fat pad, and then reconstructing through the incision. And it gives a person a much more youthful appearance.
Not only did we do my lower eyes took those bags out from under there, did the upper eyes, and I'd had some damage in the right upper eye before. So he cleaned all that up and then kind of perked up my brows a little bit. And I've got a real good friend that's in the music business that had baggy eyes like I had and took that sleepy look right out of him.
We can do it under local anesthesia. We can do it under local anesthesia with IV sedation, and we can do it under general anesthesia. It's pretty quick, it's easy, there's not a lot of recovery time. And he did it under local anesthesia with sedation. And he was in the recovery room maybe 30, 40 minutes, and his wife came and picked him up, and they went home, and he did well.
I was very, very pleased. You know, from the time I spent with Dr. Gilmer in his office, from the time I spent in the preoperative areas with the girls, the anesthesia involved, the recovery involved. Dr. Gilmer even made a house call that night. I've been very, very pleased with it, and so is my entire family.
A typical candidate for LASIK surgery is somebody that wants to reduce their dependence on glasses or contact lenses.
I'd been wearing glasses since probably high school, and I had astigmatism, so everything was just a little bit off at times. And over the years, the prescription got a little stronger. And then several years ago, I had to go to a bifocal lens, and that presented other problems. I rode motorcycles several years, and having to either have prescription sunglasses or fit my glasses underneath the helmet were sometimes problematic.
The other thing that's interesting with LASIK is that it changes the magnification of images, so that people that are used to wearing contact lenses or glasses, when they have LASIK, it makes everything clearer. They have a much clearer window to look through. The whole world looks much clearer to them and different to them than it did before.
It was a pretty simple process. What I could expect as a result, potentially I could need reading glasses down the road, but that really wasn't a concern. For me, it was really more just to not have to wear them day to day in outdoor activities.
I always tell patients it's a procedure to reduce your dependence on glasses or contact lenses. That not everyone can completely get rid of them, but that the majority of people do.
After the procedure, I wore advised to wear like a protective goggle, just to make sure that the eyes were numbed up, just to make sure that there wasn't any debris, or really to protect myself from scratching.
Barry had an uncomplicated operation. Yet Barry had a lot of astigmatism preoperatively, and his post-operative unaided vision was 20/20. So Barry's real happy and off riding his motorcycle without his glasses.
Before, it seems like I was always misplacing my glasses. I don't have to worry about where my glasses are. I can just grab a pair of sunglasses if I'm going to be outside, and things are great. I took my old glasses, put them on, and I couldn't see a thing. And I realized then that I no longer needed my glasses.
That'll do it. That'll wrap up another edition of the Best Docs Network, featuring some of the best doctors in the Middle Tennessee area that, of course, Candace, have helped change people's lives.
And for more information on any of our doctors, just log on to our website, bestdocsnetwork.com.
If you have a question or comment for us, of course, we'd love to hear from you. Send us an email at info@bestdocsnetwork.com.
That's right. Thanks for tuning in. We'll see you next week.